Well, the process when you come and see me is very involved. So I make sure that it's very thorough. The first thing is a exam, and it's not just a 5-minute exam. Our initial workup appointment takes between 30 and 60 minutes, and we're collecting a lot of information. And you have to understand, I treat a lot of physicians, a lot of physician specialists, and they come in and say, wow, we don't get exams like this. This is quite an extensive exam. And we hear that routinely. Now, that's part of the process, because most of the most important thing about seeing the patient, looking after you for the first time, is what's really going on. Is it just sleep apnea? Maybe you have insomnia. Maybe you have a movement disorder. Maybe you've had a stroke, or you've had other problems going on during sleep. So the discovery process includes a very thorough history, an examination of different systems, including muscle systems, joint systems, range of motions, neurologic checking, airway evaluation, provocation tests. And then we often do imaging, and we've got a very sophisticated imaging machine. This is a machine that takes a 3-dimensional image of not only the airway, but the sinuses, the jaw joints, and the neck too. And the reason I invested in that kind of technology is that allows me to see somebody in 3 dimensions laying down in a supine position. It's a very unusual machine. There's only a few of those in California, less than a handful. One is at Loma Linda, one's at UCLA, and we have one. And this kind of equipment allows us to visualize the airway in a situation that you would be sleeping in. So even though it's not the same as you being asleep, it sets us up posturally so that we can get more details. So we'll do imaging on you if necessary. So putting that all together, I then look at your past sleep studies, and if you haven't had past sleep studies, we'll get some sleep studies for you. We want to have good information on which to base a treatment plan and a diagnosis for you. And I don't diagnose these things alone. I work with your physicians, and oftentimes a physician will send you to me to work you up, and I will work you up and work with the physician to come up with a good plan for you. I have people that travel a long distance to come and see me, and it's because they have such a complicated problem. I can't sort out their problems so quickly. It takes a little longer. But once we've gotten through the initial evaluation and the patient understands what's going on and how important it is to get therapy, then we move into treatment. And the treatment can be 3 visits, can be 6 visits. It's usually over a 3 to 6 month period. Once that's done, we're on a maintenance program. And at the end of the therapy, we are making sure that the treatment has worked, that it's effective, and we're making sure that you can comply and use it and it's workable for you.